the cardiovascular system is the first thing that's affected. Autoimmune disease also affects the whole process. Venous stasis, that is things like varicose veins, venous stasis. And eventually, they lead to hypercoagulable state. What does that mean? The blood becomes very thick, and all the parameters in it show that the blood is thick. People who have varicose veins develop blood that just sits in the legs. Eventually, they get pulmonary embolus, which is a clot in the lung. Gradually, the pressure on the right side of the heart increases, and they become worse and worse and worse. Other ones where they gain weight or have high cholesterol, high triglycerides, cardiovascular disease causes that blood to clot. Autoimmune disease, very similar. So how do we connect those diseases to that coagulation change? Hypercoagulable state is very important because it is one of the most dangerous aspects of these entire syndromes, where it's weight gain or inflammation or any of these cardiovascular disease, autoimmune disease, venous disease. You get that hypercoagulable state, and you get an increase in one of the parameters of the blood called PI1. PI1 stands for plasminogen activator inhibitor 1. And I will describe for you how coagulation works in a simple way. Any of you who have been in contact with people that are in medicine will describe coagulation in a rather complex fashion. I'm going to show you how it really works in its simple form. But in any case, PI1 equals plasminogen activator inhibitor, which is actually the linchpin of what controls coagulation in our body. If the PI1 increases, our blood gets more sticky, it becomes like super glue, produces fibrinogen, which I'll show you. If the plasminogen activator inhibitor, which is PI1, decreases, we go towards normal. We can't lose it completely because it does control everything, and it does control cellular function also. So let me go into what really causes all of those changes. Cardiovascular disease, autoimmune disease, venous disease, infection and inflammation, cancer, chemotherapy are big, big factors that increase the hypercoagulable state. So, cardiovascular disease such as metabolic syndrome, you've heard that, and inflammation and weight gain. You've seen that diabetes can be a factor. Also, what does diabetes mean? It actually means the oxidation of the LDL. LDL, or bad cholesterol, rusts. Ox-LDL is rusted LDL. And with it, the albumin, or the protein in our blood, becomes caramelized, glycated. For those of you who are not in medicine, glycated means caramelized, and a portion of it is caramelized. And that's how we measure how well diabetics have done. The A1C is nothing but a measure of the glycated hemoglobin. Both increase production of PI1 and therefore makes the blood a lot more sticky. Can everybody hear me, or am I getting away from the... So, as the PI1 increases and it becomes sticky, it causes more complications. Let's look at this in a slightly different way and look at what happens when that PI1 increases. As I told you, cardiovascular disease, venous disease, and stasis all cause the same thing, but a big factor is autoimmune disease, such as rheumatoid arthritis, Crohn's disease, IBS, which is irritable bowel syndrome, and there are many, many other autoimmune diseases, including psoriasis and others that cause that problem. So, what happens in autoimmune disease? The CD4 cells, which are up there, and the CD8 cells, which are part of the immune system, have to have a balance. If the CD4 cells are less, and the CD8 cells, which are the killer cells, are more, you get autoimmune disease or the effects of autoimmune disease. Here is a representation of it. What that does when autoimmune disease occurs is inflammation due to the formation of cytokines. So this is a description of the coagulation process. On your left there is the TPA and plasmin precursor, which leads to the formation of plasminogen activating enzymes, and the plasminogen and the plasmin, all on the left. That's the process that keeps the blood fluid. So essentially, what the blood vessel does is produce what is at the bottom, and that is the plasmin. That's the function of the cells in the blood vessels. They produce plasmin, which is activated and keeps the blood thin. On the other side, on the right side, the process to stop bleeding is the fibrinogen at the top, the thrombin, which produces the fibrin monomer, fibrin polymer, and then down at the bottom is the fibrin mesh. So it's the balance between keeping things fluid on the left and trying to stop that on the right. So when you get more of the stickiness, if the blood is going to stay fluid, you're going to have to produce more of what's on the left to keep it fluid. And it's that balance that makes the blood stay in circulation. So how is that related to pi 1? On the left side, if it increases, it becomes too fluid. On the right side, if it increases, it becomes too sticky and forms a fibrin mesh. Plasminogen activator inhibitor, or pi 1, comes in when we have cardiovascular disease, inflammation, where that red sign is. As you increase the pi 1, you increase the coagulation of the blood, and you get more formation of fibrin, thrombin, and you get the fibrin mesh. This is a little difficult to understand from a mechanistic point of view, so what I'm going to do is show you actually what happens in the blood vessels. And then I will show you some of the clinical work we did. So the most important balance is what's on the left and what I've enlarged, which is pi 1, plasminogen activator inhibitor. If that increases, blood becomes thick and increases what's on the right, which is fibrinogen and its byproducts, and it holds on to the cells and the platelets.